Good afternoon, everyone, and thank you for joining today's update on COVID-19 in North Carolina. As of today, we have 79,349 lab-confirmed cases, 2,039 new cases reported since yesterday, 1,034 people in the hospital, and sadly, 1,461 people who've died. We continue to pray for the victims and their families. Today, we're continuing to watch with concern as COVID cases and hospitalizations increase. Today, Dr. Mandy Cohen, our Secretary of the Department of Health and Human Services, will share an update on our data trends that our state monitors as we battle this pandemic. Today is our highest day of hospitalizations and our second highest day of cases. It's good that we still have hospital and ICU bed capacity, but what we know is this: the disease continues to spread, and though North Carolina isn't a surging hotspot like some other states, we could be if we don't stay strong in our fight. There are critical decisions ahead on how we reopen schools and whether we continue to ease restrictions on certain businesses. On schools, we continue to get excellent input from teachers and superintendents and health officials. We want our children back in school safely, and we'll have an official announcement next week. We'll also have an announcement next week about the executive order that ends on July the 17th. On the COVID testing front, we're experiencing new delays in getting test results back. It's tough when a person gets a test and sometimes has to wait almost a week to get the results. That's unacceptable. Labs here and across the country are slowing down, partly due to a nationwide shortage of important testing supplies. Meanwhile, we continue to make progress in chasing down and working to contain the disease. Contact tracers help us notify people who may have been exposed, and we're hiring more of them. We had planned to hire 250 new contact tracers, but it's gone beyond that. We now have 480. Half of whom are bilingual with a focus on Spanish speakers. With these additions, we have more than 1,500 people in our state working on contact tracing. We know we need more. Every state needs more. And every state is facing similar challenges in this work. Please know that if you get a call from a contact tracer, work with them. It's important for your health and the health of your family. We're also deploying up to 300 new no-cost testing sites concentrated in our underserved communities that currently have limited testing options. These free sites will increase capacity in more than 100 zip code areas across our state. This pandemic is hitting historically marginalized populations really hard. Long-standing inequities have left these communities more vulnerable to COVID-19. And this major addition of free testing sites will help save lives. Testing is only a part of the picture, though. We need to support people and their families who've gotten sick. Today, we announced that the Department of Health and Human Services is beginning an initiative that will send up to 250 community health workers to areas with high COVID-19 caseloads. These health workers will work closely with local health departments and contact tracers and be responsible for connecting North Carolinians to medical and social support resources. That includes testing in primary care, mental health services, and helping people find a safe location to isolate if they test positive. We've seen cases surge within the communities as entire families become sick because of an inability to isolate a positive family member. Today, we're also pleased to announce a new program aimed at matching students in need of work experience with local governments and nonprofits who need additional support for COVID-19 response. The Student Response Corps initiative will provide virtual public service internships. This is a win-win for students who may have lost jobs or internships due to the pandemic, and for local governments and nonprofits who are in need of extra help right now. This effort is a part of my administration's NC Job Ready initiative to make sure students are prepared for the jobs of today and tomorrow. Job readiness may be even more important during a pandemic. For students interested in being matched up with a job or an internship, we'll link more information on our website. I'm now going to ask Dr. Cohen to share an update on our state's data and trends. So Dr. Cohen, I'll recognize you.
Great, thank you, Governor. Good afternoon, and as the Governor reported, across the state we see an increasing number of cases and a number of concerning trends in data, which I'm going to break down for you in a minute. But nationally, we continue to see dangerous spikes in viral transmissions in a number of states, and some areas where medical systems are hitting capacity. That's alarming. While we in North Carolina are not in dire straits like some around us, we have reason to be concerned and need to remain vigilant in slowing the spread of the virus. Flattening the curve is not a one-time thing. It takes constant effort and attention to keep it flat. I know North Carolinians don't shy away from doing what is needed to keep our state strong. I'm heartened to see people wearing their face coverings when they're out and making an effort to keep their distance. Okay, so now turning to our trends. As a reminder, we use a combination of metrics that are based on public health data and original White House guidance. These metrics include COVID-like syndromic cases, lab-confirmed cases, positive tests as a percentage of total tests, and hospitalizations. Some of these indicators help us understand the rate of transmission in the past few days, while other metrics, like hospitalization, tell us where we were a few weeks ago. That's why we think of these indicators as different chapters in the same book, instead of relying on any one metric to tell the whole story. All right. So our first graph, again, looks at people who have come into the emergency room with COVID-like symptoms. This is the most timely data we have, and it's our earliest detection mechanism. So taking a look at the yellow line, you can see that this is increasing. This metric is not impacted by testing rates or other factors. It's an early warning indicator. For the past few weeks, this data has been telling us the virus is spreading in our communities, and this continues to be concerning. On our next slide here, we look at lab-confirmed tests. It's another one of our more timely key metrics. We continue to see an increase in new lab-confirmed cases with COVID-19. We would obviously like to see these trends level off, but unfortunately, it continues to go upward. And as you can see over to the right today, we have that second highest day of new cases at 2,039 new cases today. Over the last week, the number of tests being performed actually has been relatively flat, which is related to a number of factors. Now, we had a holiday weekend, so that's a factor, but we've also seen increased nationwide demand for testing, which is slowing down the test processing times. And we're seeing ongoing supply chain challenges with various laboratory reagents and supplies, some of the chemicals needed to analyze testing samples. We continue to ask our federal partners for decisive action on this front. Now next, we look at the percent of tests that are positive. And you can see the yellow line, the percent of total tests returning positive, it's really been in that 8 to 10% range, relatively stable. But we'd rather see this number closer to 5%. So while it's stable, it remains elevated. And our next metric here is day-over-day hospitalizations. This metric continues to increase, and we have now more than 1,000 people currently hospitalized with COVID-19. Right now, our hospitals still have capacity to meet this increased demand, and that's a good thing. However, again, the people who are going to the hospital today are those who were infected days or weeks ago. That's why we call hospitalizations a lagging indicator. The more timely indicators that we've discussed suggest that infections are increasing, which is why we need to think about how this hospitalization metric would be moving a few weeks from now. We are particularly concerned about the Charlotte area and their hospital capacity. Our team, we're in touch with them all the time, but had a call with all of the hospitals in the Charlotte area. And I'll say, they're doing a great job of handling the higher number of cases they're seeing and are really being thoughtful about planning for more. At this point, there is not a need for further intervention, but we will continue to reassess this decision. We don't want to be in a situation where we're nearing our ICU capacity, and we want to avoid a situation where hospitals are forced to postpone procedures or surgeries or other essential non-COVID care. Okay, so where are we today? Our surveillance data continues to increase, so that gets a red X. North Carolina's trajectory of lab-confirmed cases continues to increase. That also gets a red X. North Carolina's trajectory in the percent of tests returning positive remains stable, but is concerningly high, so we give that a yellow line. Stability is good. We're not experiencing the spikes that many other states are, but as I said, we'd like to see this number cut in half to about 5%. North Carolina's trajectory of hospitalizations had an uptick, but we still have capacity, so this trend gets a yellow line. As we think about tracking our critical capabilities, those abilities that allow us to respond to this pandemic, here we see a mostly positive, good sign and good trends. Testing, you'll notice, has a diagonal arrow this week. While we continue to complete a high number of tests, around 20,000 per day, again, that national shortage we're seeing in critical supplies has reemerged. And as a result, labs are taking longer to provide results. Federal action is needed. On contact tracing, we continue to hire contact tracers, as the governor mentioned, to bolster our efforts with our local health department, and our PPE supplies are stable. We are in a critical period right now, and we need all hands on deck so we can maintain capacity through our health systems, get our kids back to school, and reignite the economy. Our collective hard work to slow the spread of the virus has allowed us to avoid what we're seeing in other states. But ongoing attention is needed. Each North Carolinian has the responsibility to one another to practice the 3 W's: wearing a face covering over your nose and your mouth, waiting 6 feet apart, and washing your hands often. Wear, wait, and wash. Thank you, Governor.
Thank you, Dr. Cohen, for that update. Our trends are not where we want them to be right now. It's good that we still have hospital and ICU bed capacity. But as Dr. Cohen said, we watch this closely and are paying particular attention to our hospitals in the Charlotte area. Just take a look at some of the other states where a swift uptick in cases quickly caused hospitals to fill up, and we do not want that to happen here. So as the summer continues on and we all try to salvage family traditions and vacations, please continue to treat this virus like the deadly threat that it is. Find ways to connect with friends and family in a safe way. Wear your face covering in public when you're around others. And treat each other with kindness as we all work to do our part to fight this virus. Also with us today is our Secretary of Public Safety, Eric Hooks, and Emergency Management Chief of Staff, Will Ray. Monica McGee and Cameron Larson are our sign language interpreters, and behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. We will now open the line for questions, and if you can identify yourself and the name of your organization, we would appreciate that, and we'll take our first question.
Our first question is from Eric Spanberg with the Charlotte Business Journal.
Governor, you've spoken often about trying to balance the public health side of this with the economic concerns, and I'm wondering, given the trends of what you're seeing with the cases, how do you try to offset those at this point, particularly for some of those businesses that have not been able to reopen, such as fitness centers and bars?
We very much want to have all of the economy open as quickly as we can. We have to keep the public health and safety of North Carolinians number one, and we have seen these other states where you've seen elevated percent positives, you've seen hospital beds fill up, and it can jump on you quickly. One of the least expensive and easiest way for us to get our economy fully humming again is for people to wear the face coverings, practice the social distancing, and continuing to wash their hands. I know that's simple and we say it over and over and over again, but it's so true. because if we do that, we can make progress on this virus and we can continue to ease restrictions. And one of the most important things we've got to do is to get our children back into our schools. So everything we do, all the efforts that we make, we're trying to make sure that we can get this economy humming again and giving the people confidence to engage in the economy again. And we do that by making sure things are as safe as possible. Thanks. Next question.
Our next question is from Garrett Bergquist with Spectrum News.
Good afternoon, Governor. Garrett Bergquist here with Spectrum News 1. Couple questions. The state Republican convention was scheduled to start in Greenville today. It's now going entirely virtual. The Republican state party leadership is claiming that DHHS waited until basically about 10 days out to inform them that the measures they had in place were not going to be adequate. Wanted to get DHHS's response to that. Were there any efforts to communicate with the Republican Party prior to the end of June? And then second, what specifically was wrong with the state GOP's plan? Why were the measures that they had proposed not enough?
It's my understanding that the State Department of Health and Human Services gave them the same advice that they would give any large gathering. When you look at the numbers that are elevating across the country, and when you see how rapidly the virus can spread, particularly when you have large crowds together indoors, obviously the State Department of Health and Human Services would tell them they probably shouldn't do that. And I commend them for taking that advice and canceling the convention. Dr. Cohen, I don't know if you have anything additional. She doesn't have anything additional on that. You know, pandemic response cannot be partisan, and I think the Department of Health and Human Services provides that advice to anybody that would be planning any kind of large gathering. Next question.
Our next question is from Kate Martin with Carolina Public Press.
Good afternoon, Governor. This is Kate Martin with Carolina Public Press. Please correct me if I'm wrong. If someone is thought to have been in close contact with a COVID-19 positive person, they are asked to isolate at home for several days until their test results come back. How is this going to work in a school environment? Teachers will be exposed to dozens of children throughout the day. If there's a single positive case, will everyone who's been in contact with the COVID positive person be asked to isolate? And what about teachers who are considered at higher risk for injuries and death because of the health issues or their age? I realize this isn't an easy decision because there's parents at home who need to work and may not be able to if their children are home, but I'm interested in your thinking when you're coming up on making this decision for the state. Thank you.
Those are good questions, and those kinds of questions are being thought out right now as the plans are being put together and that we will announce next week. We want our schools to be safe for students and for teachers, and the plan that we're going to put forward works toward that goal. And I'll let Dr. Cohen respond to the rest of the question.
Hi, Kate. Thanks for that question. In terms of folks who come into close contact with someone who is a confirmed positive, whether it's in a school or another setting, we want close contacts to stay home and stay quarantined for 14 days to get tested, obviously, but we want them to stay quarantined. Now, I was specific in saying close contacts, and remember that means being within 6 feet of that person for more than 10 minutes. And we know in a school setting, like a classroom, that is possible, which is exactly why we are putting in additional protections that help reduce that risk of viral transmission. Things like face coverings, things like social distancing, right? So that you aren't within 6 feet for long periods of time with folks, even when you're in a classroom, right? When you're in stationary places, you are able to maintain that social distance. Again, it's the good hand hygiene and all of that. But look, we know that this virus spreads, and we need to also have protocols in place that if we see a positive case in a school, that we have particular protocols. And those are the kinds of things, as the governor mentioned, that we are working on and supporting the schools in order to make sure that they have those. As far as teachers or students that may have medical reasons or their age that puts them into a higher risk category, yes, we have already in our guidance that says that we need to make sure that there are going to be opportunities to make accommodations for those folks. And again, when we all do our part to wear face coverings, we're not just protecting our students, we're protecting those teachers as well. So I think it's that comprehensive strategy that we've been working on from the public health perspective, but also from the educators and the teacher and student perspective that we've been working on so hard. Thanks.
Thank you. Next question, please.
Our next question is from Claire Donnelly with WFAE.
Hi, Claire Donnelly with WFAE. Secretary Cohen, I know you've been talking a lot about the testing bottleneck and those ballooning wait times. I'm wondering how many supplies like those reagents you guys are short, and then what the plan is for getting more. I know you said you talked to Secretary Azar, but is there any update on that? What's the plan going forward? Is it just going to keep getting worse? Thanks.
Thanks, Claire. So I want to be clear about who is having the supply shortage. So we have a state public health lab, and actually our lab has the reagents it needs. It is really the hospital systems that have some of our higher throughput testing devices that are really seeing the shortage. Now, because we, the state lab, are able to get some of our supplies directly through a mechanism through the CDC. But it's the hospital systems that deal directly with some of these suppliers that are really having challenges. And I'll give you an example, which then further strains our other systems. When our hospitals can't be testing and using their throughput at the capacity that they want to, then they have to send those tests somewhere. And what they do is they send it to some of our commercial labs, which are already seeing a high volume because of what's going on around the whole country. So what we're seeing, for example, we've worked closely with Atrium, with Wake Med, with others who are having supply issues in a myriad of things. It's like all of the things, and you fix one, and then another hole develops. You make sure you have enough pipettes, and then you don't have enough chemical reagents. It's actually a lot of the supply chain is just really tight. So what we want to do, and it's really our hospital systems that are really feeling squeezed with the reagent issue, and then they're having to rely on moving their samples and to getting them run at the commercial labs that are already seeing, as I said, a high volume. So we want to work, again, with the federal government as best we can. I think the thing that would be most helpful is honestly transparency. Like, where are these supplies? Where are they going? Because we know in North Carolina, we're not the only ones experiencing this. So I think the first step that we would ask for is transparency, and then work to see how can we improve these supply chains as we go forward here. Thanks.
Next question, please.
Our next question is from Dawn Vaughn with the News and Observer.
Hi, Dawn Vaughn with the News and Observer. Thanks for taking my questions. I wanted to see if I could get you all to expand a little bit on Kate's question about the response when there are outbreaks at schools. And since the DHS dashboard has those reports of ongoing clusters in childcare and school settings, will that also be expanded to include the universities, since athletes are already back on campus?
I'll let you take the question.
Hi, Dawn. So as we've shared and what we post on our website, there are certain entities that are required by law to report to us an outbreak or a cluster. An outbreak is 2 cases, a cluster is 5. For child care and schools, that means K-12, public or private, those are the entities that are required to report to us, and we already post those on our website, not just the detailed information, but we do post the exact location of where that outbreak is. And you can see we've had quite a low number of outbreaks in child care settings or in schools. Actually, the school outbreaks that we've reported have really been amongst teachers who have been coming back to the building without students. And I think it reminds us that we want to make sure, of course, to have our students do social distancing, but we have to remember the adults in the building actually are the ones that are more easily the ones that transmit the virus. We actually see children not being as good at transmitting the virus, which is a good thing, but we got to make sure the adults, the staff, the teachers, and others, making sure they're not congregating in various parts of the school. The couple of outbreaks that we've seen have really been just teachers who are working in close proximity without face coverings. Again, it goes back to the kinds of requirements that we have in our school guidance for face coverings and other precautions to slow the spread of this virus. We know that these activities are going to reduce the risk. It doesn't eliminate the risk. So when we see an outbreak, if that was to happen, we have protocols in place that we work with our education partners on how they can do the appropriate amount of response to those efforts. Thanks.
Thank you. Next question, please.
Follow-up, Dawn Vaughn, News and Observer.
Hi, thanks for taking the follow-up question. I just wanted to ask more about masks, especially in schools and other government buildings. Who will be enforcing the mask wearing? And also for Governor Cooper, I understand that Secretary DeVos was on a call with governors earlier this week. Were you on that, and what did you think of what she said?
Well, we know that face coverings are important in slowing the spread of this virus. And when we make an announcement on schools next week, we're certain to talk about face coverings because they do a good job of slowing down this virus along with social distancing and washing. We're on calls with the coronavirus task force at the federal level frequently, either the president or the vice president. This past week we did have the vice president and Secretary DeVos talk about wanting to get our children back in school. I think it's really important that we separate all of the politics here and talk about what's best for our children. We know that they need to get back in school. They need to do it in a safe way, and that can be a combination of in-person learning and remote learning, depending on the circumstances, depending on the student. But we have been working on this for quite a while. This is a tough call. How to open up schools is something that every single state, every single governor is struggling with. And governors who were on that call were talking about how they were going to approach this in their state. Each state will be different because each state is having a different kind of fight with the spread of coronavirus. Each state has a different education model set up. But I think it's important for us to work together to make sure that our children get all of the benefits from school. We want them to get the nutrition and the health care and the socialization along with the academics. But we also recognize that our teachers need to be safe and our students need to be safe. And that's why we're working so hard to get this right for North Carolina. And I can't remember, I can't remember if there was a follow-up for Dr. Cohen, but thank you for that. Next question, please.
Our next question is from Savannah Levins with WCNC.
Hi there, Savannah with WCNC. Thanks for taking my call. Latest data in North Carolina statewide shows we are at 76% hotel or hospital bed capacity for inpatient, 80% capacity for ICU beds. Are we at the point where we're concerned about this? And at what point, is there a threshold where immediate action is going to be needed to be taken? And what would that action look like? Would it be considering field hospitals? And at what point would we have to consider that kind of immediate action? Thank you.
Yes, we are concerned about this because we're seeing a continued steady increase in our hospitalizations, with today being a new high. But as you heard from Dr. Cohen earlier, we're in constant contact with our hospitals. And remember, when this pandemic began, the hospitals were able to surge and they were able to create more hospital beds and more ICU beds by doing less other procedures in order to be able to handle the potential surge of coronavirus cases. We worked hard. We didn't end up having that surge, but hospitals learned how to make that surge. So the numbers that you're seeing now on the dashboard reflect the capacity that we have now, but remember that hospitals can surge up and create even more capacity, both with hospital beds and ICU beds. And we can continue to keep a watch on that. We've seen how quickly this virus has jumped on other states and on other medical systems. We don't want that to happen here, and that's why our Department of Health and Human Services is doing such a good job with communicating with our hospitals across the state. We want to avoid that kind of thing. That's why we're keeping such a close eye on the numbers. And with these lagging indicators, that's why you have to keep an eye on people that are going to the emergency room with COVID-like symptoms. That's why one of the many reasons we want to speed up the time of getting a test result, because the more time that goes by, the longer that person has to sit there, and the longer the lag in those numbers that go up on the dashboard telling us where we are. So we're continuing to watch this. We're going to continue to take action to make sure we slow the spread of the virus. And say again, each and every one of you out there can make a real difference by wearing a face covering, standing 6 feet apart, and washing up. Dr. Cohen, would you want to add to that? Okay. Next question, please.
Our next question is from Richard Craver from the Winston-Salem Journal.
Yes, Governor, this is Richard Craver from the Winston-Salem Journal. I have a question, I guess, more for Secretary Cohen. At this point, being July 9th, have y'all actually seen any evidence of any kind of super spreader or any kind of event, whether it's the protest or any kind of public event that has led to the increases in not only cases but hospitalizations?
Hi, Richard. Thanks for that question. What I think we are seeing is a slow and steady increase in our cases. We haven't seen one event that has set off a fire within our state like we have seen in other states, and that's a good thing. So I do want to thank all of North Carolinians who are really working hard to do their part on social distancing and wearing a face covering. I think it is working. It doesn't mean we're stable yet and we have more work to do. What we're seeing in terms of spread of virus now is really in workplace settings and at home. And so people are potentially transmitting this virus in work settings, particularly higher risk work settings, agricultural settings, manufacturing settings, meat processing plants. Those are the places where we have definitely stepped up efforts on prevention, right, with not just face coverings, but wearing medical grade face covering masks in some of those settings. So I think we're doing as much as we can, but we always need to do more on the prevention side with more and more focus on face coverings and social distancing. But what we're also seeing is that while folks may get exposed and pick up the virus at work, they're bringing it back to home and their communities. So we are starting to see more spread in some of the leisure activities. We're seeing spread in church. Obviously being spread within the home. Governor Cooper mentioned in his remarks earlier about how we're seeing spread to families, and we want to make sure we're helping folks isolate even from their own family members, which is incredibly hard, and we need to support people to do that. And it is not an easy thing to do, particularly when staying home means not being able to pay rent or put food on the table. Again, this is why some of the work we're trying to do with our community health workers and some other additional surging of resources to help people be able to stay home. But I would not say we see anything like a tie necessarily to a protest or another gathering at this point. I will say we see some of those gatherings happen, and we do see increases in those spaces, but yet we haven't yet been able to tie it to any one thing, which is why we want to make sure everyone is being careful in all of the different public settings that they're in. Thanks.
Thanks. Next question, please.
Follow-up, Richard Craver, Winston-Salem Journal.
Yes, Governor. The other question I had was, given the outcome of the veto bills yesterday, are you anticipating any more or any additional reopening type bills, whether it's involving a council of state or individual industry sectors, especially since we're sort of in a limbo position with the bowling alley legal actions?
I think the legislature is gone until September the 2nd, so I don't expect any more of those kinds of bills to come before us. Not until then, anyway. Next question, please.
Our next question is from Lake Wood with WASW.
Good afternoon, Governor Cooper. Lakewood here with WASW News. As many school districts look into in-person learning to some extent this fall, how can you ensure that there is enough PPE for students and faculty? And how would the state distribute protective equipment to school systems statewide?
When we do open schools, we want to make sure that all of the teachers, the faculty, the school employees, and students have enough PPE. There's several ways that that's happening. First, the federal government has provided some funding to local schools to help with COVID response. The state of North Carolina will also be helping. We passed legislation that provided, I think, $7 million for that, but we hope that additional state money can come. And, you know, we hope that individual people and businesses and nonprofits will also pitch in to help our schools. They do that anyway on school supplies and things that schools need, but now PPE will be something that schools need as well. So we hope people and members of the community will help step up and make sure that they have all that they need. We want to, as a state, also make sure that our schools have all that they need. Would you have anything to add to that, Dr. Cohen? Okay.
Just one thing to add as a reminder, the state has already distributed protective equipment to healthcare and nurse professionals in our schools where they may need a higher level of protective equipment because they are administering different kinds of treatment for students. So that delivery of protective equipment has already occurred for our districts around the state. Thanks.
Thanks. Next question, please.
Follow-up, Lakewood, WASW.
Yes, and how often will students and staff be tested for COVID-19 in schools across the state, if at all?
Hi, Lake. Good question about testing. And we're really, as we've been talking about today, we're already seeing ballooning testing times. And so it's been interesting to think about where is testing appropriate for which populations. And I think there was what was talk or thought, should we be doing any proactive testing of folks before we return to school? And really that has not borne out in the research and the scientific evidence. And what we are really focusing on, again, are the simple, low-cost, very prevalent actions that we can take related to face covering, social distancing, hand washing, other hygiene mechanisms. So that's really where we're focused on. Testing really becomes important when someone has a symptom or they've been exposed to someone with COVID-19 and have been in close contact with them. Then there are some other places where folks work in high-risk areas or in high-risk jobs that we also want to encourage testing, and of course if folks have been in a mass gathering. So those are the places where we're really focused in terms of our testing at this point. So there's no plans for any proactive testing in order to make sure that kids need to come back to K-12 education. Again, we can continue to monitor this with a scientific research, but it does not lend itself to moving in that direction. What it really continues to reinforce are these lower costs, but much easier to operationalize and execute on are the face coverings and the social distancing and the hygiene. Thank you.
Next question, please.
Our next question is from Rose Hoban with North Carolina Health News.
Transparency.
Rose, you there?
Hello?
We
Hello,
can
can you hear me? Okay.
We can, yeah.
Okay. So, speaking of transparency, Secretary Cohen this week during a roundtable hosted by the Keenan Flagler Business School at UNC, the experts there praised yours and the governor's response to the pandemic, but they also said that in order for businesses to know what to do, they need more granular data. For example, we're seeing an increase in hospitalization. Like, how old are those patients? What kind of status? Like, are they on normal beds, ICU beds? And that they would better be able to gauge what to do. Is that kind of data going to be more accessible to the public?
Thanks, Rose. And we think data is very important. It's why we've put such a focus on having our dashboard be updated, and we put new data up all the time. We just put new data down to the county level on demographics and on testing, and we'll continue to add additional data to that dashboard. I do think it's important, but really the important things that I think are going to help businesses continue to stay open and make sure that we don't have to go backwards like we're seeing a number of states do is face coverings. It's washing your hands. It's waiting 6 feet apart. So those are the things that I hope to see in the next iteration of work by all of the business academic community, is to focus on how businesses can support those simple activities in addition to data. I don't want to take away from the importance of it, but it's focus on the actions we can take today, right now, in order to reignite the economy and keep businesses open and keep us moving forward and making progress. Thanks.
Next question, please.
Follow-up, Rose Hoban, North Carolina Health News.
Thank you for taking my follow-up. I'm actually working remotely from New York State this week, where I'm visiting family. And here, the rate of positive tests is 1%, as opposed to ours being 9 or 10%. I'm seeing much more vigorous enforcement of the mask mandate here, such as fines being levied. Have you folks considered more rigorous enforcement of the mask mandates in North Carolina?
We're continuing to encourage businesses to make sure that people have masks on when they come inside, and we're seeing more and more of them do that. We want to get our percent positive down. We're continuing to hover between 8 and 10%. But the work that we've done has prevented North Carolina from getting into the 20% or more in some of these other states that have experienced this surge lately. We know that face coverings are a key to this, and what we need even more than enforcement here is for leaders across this state, political leaders, celebrities, sports figures, business leaders, to step up and, number one, wear the face covering to show this is something that you ought to be doing, but talk about it. And I think if we continue to push this and continue to get people to understand that this is the best way to get our economy going full speed again, and making sure that people understand that and stop spreading false science that we know is not true. These things work. They aren't 100% foolproof, but they significantly reduce the spread. So we'll continue to look at all avenues of enforcement, but we need to get buy-in from the people here, and that's happening more and more. And we just need leaders across this state of all stripes to step up and help us with this. Thanks. Next question, please.
Our next question is from Hannah Jeffries with WITN.
Hi, Governor. Hannah Jeffries with WITN News. The NC GOP held a press conference this morning at the site of where they were supposed to hold their convention tonight. Chairman Michael Whatley claims that they took drastic steps to make sure they were ready to attempt to hold this safely, but that your administration didn't work with them to see that through. He says if they would have gone forward with it, there would have been potential criminal and civil penalties associated. What do you think about this claim?
So as I said earlier, the Department of Health and Human Services, the state health director worked with them just as they would any other organization that would want to hold a large gathering. Recommended against it, particularly when you're seeing these spikes in other states and you're seeing COVID-19 being spread indoors in large crowds, recommended against it, but also provided some suggestions to them if they were going to hold it anyway. I commend them for making the decision to cancel the in-person part of their convention. I think it was a smart thing for them to do. Next question, please.
Follow-up, Hannah Jeffries, WITN.
So just to clarify, Governor, there would not have been criminal or civil penalties associated if they did decide to go forward with the convention.
Don't know what they were going to do, but what the state health director did was give them advice on what they should do if they were going to hold this convention, but she also recommended that they not have it because having hundreds of people indoors can spread COVID-19. And they made the decision that they were not going to have it, and I think it was a good decision. Next question, please.
Our final question today will be from Laura Leslie with WRAL.
Hi, Governor. It's Laura Leslie with WRIL. I hope you're well. A couple questions relating, well, one relating to this most recent legislative session. As you're no doubt aware, a state law will require all students to be back in school physically for the first 5 days of the school year. Legislators decided not to change that. I guess I'm wondering, question for you and for Secretary Cohen, is that something that schools can have or you can have any say in, and is there a way to do that safely at this point?
Well, we will announce next week. We're going to have the culmination of all of this work that has gone on amongst teachers and superintendents and health officials, and it's going to be something that follows the law, and it's going to be something that gets our kids back into school safely. And I believe that that kind of getting back into school is going to require some in-person but also remote learning. And we look forward to presenting that plan next week. Dr. Cohen, if you wanted to add anything to that. Okay, thank you all very much for being with us today. Please stay safe and healthy out there. Thank you very much.